Depression is a mental disorder that affects millions of people around the world, being one of the most common conditions in mental health. Often misunderstood, depression is not simply a phase of sadness or discouragement, but a real disease with symptoms that deeply affect the body and mind. In this script, we will address what depression is, its causes, symptoms, diagnosis, treatment, and how people can seek help. 1. What is depression? Depression is an emotional disorder that causes persistent feelings of sadness, emptiness, and hopelessness. It goes beyond a simple passing sadness or a temporary malaise. Depression interferes with the person's daily activities, affecting their functioning in several areas of life. The person with depression often cannot find pleasure in the things they used to like and may present excessive fatigue, changes in sleep, appetite, and self-esteem. Depression is a multifactorial disorder. That is, it can be caused by a combination of biological, psychological, social, and environmental factors. 2. Symptoms of depression. Symptoms of depression may vary from person to person, but generally include persistent sadness. The person feels a deep sadness, which does not pass easily and can last weeks or months. Loss of interest. There's a lack of pleasure in activities that were previously pleasant, such as hobbies or work. Sleep changes. There may be insomnia or, on the contrary, excessive sleep. Extreme tiredness. Even after a period of rest, the person feels constant fatigue and lack of energy. Feelings of guilt or uselessness. The person may feel inadequate, devalued, and often believes that it is a burden to others. Difficulty concentrating. Simple tasks can become difficult, and the person has difficulty making decisions. Changes in appetite. Loss of appetite or increased food intake are common. Some people can lose weight, while others can gain weight. Suicidal thoughts. In severe cases, constant thoughts of death or suicide may occur. 3. Causes of depression. The causes of depression are complex and often combine several factors. Below are some of the most common causes. Biological factors. Changes in the brain, especially in neurotransmitters. Chemical substances responsible for communication between neurons, such as serotonin, dopamine, and noradrenaline, are associated with depression. In addition, genetics plays an important role, as depression may be more common in people with a family history of psychiatric disorders. Psychological factors. Traumatic experiences, such as childhood abuse, loss of a loved one, or prolonged stress, can trigger depression. People with low self-esteem, excessive perfectionism, or difficulties in dealing with emotions may be more vulnerable to the development of the disease. Social and environmental factors. Financial problems, relationship difficulties, or stress at work are factors that can contribute to depression. In addition, social isolation and lack of emotional support can aggravate symptoms. 4. How is depression diagnosed? The diagnosis of depression is made by a mental health professional, such as a psychologist or psychiatrist, who performs a detailed evaluation of the person's symptoms and history. There is no single test to diagnose depression. The process mainly involves a clinical interview, where the professional seeks to understand the symptoms, intensity, duration, and impacts on the patient's life. In addition, the professional can use questionnaires and standardized scales to evaluate the degree of depression and determine the most appropriate treatment. 5. Treatments for depression. The treatment of depression is multifaceted and may involve different approaches, depending on the severity of the symptoms. Below are the main forms of treatment. Psychological therapy. Psychotherapy, especially cognitive behavioral therapy, CBT, is one of the most effective forms of treatment. CBT helps the patient identify and change negative thinking patterns, developing healthier ways to deal with stress and emotions. Antidepressant medications. In more severe cases, the use of antidepressant medications may be necessary. These drugs help correct chemical imbalances in the brain, which can be responsible for the symptoms of depression. It is important to note that the use of antidepressants should always be supervised by a psychiatrist. Social support. The support of friends, family, and support groups can be fundamental in the recovery process. People with depression can feel isolated, so emotional support can help reduce the impact of the disease. Asterisk physical activities and healthy habits. Regular exercise, a balanced diet, and relaxation techniques, such as meditation and yoga, can help improve mood and reduce stress. Asterisk alternative treatments. In some cases, alternative treatments such as acupuncture, light therapy, or relaxation techniques can be used in conjunction with other forms of treatment to improve emotional well-being. 6. How to deal with depression in everyday life. Dealing with depression can be challenging, but there are some strategies that can help. Asterisk recognize the symptoms. The first step in dealing with depression is to recognize your symptoms and seek help. Do not hesitate to seek medical or psychological support, as early intervention can be essential. Asterisk establish a routine. Depression can cause the person to lose the motivation to perform daily tasks. Establishing a simple routine can help give structure to the day and avoid the abandonment of essential activities. Asterisk exercise regularly. Physical activity has proven effects on improving mood, as it releases endorphins, chemical substances that promote sensations of pleasure. Asterisk talk to someone you trust. Talking about feelings can relieve the emotional load. Sharing difficulties with a friend or family member can help reduce the stigma associated with the disease. 7. The importance of prevention and self-care. Although depression often arises without warning, self-care practices and the adoption of a healthy lifestyle can help in prevention. Having a balanced diet, practicing physical activities regularly, maintaining a good sleep, and developing skills to deal with stress are essential to maintain emotional well-being. In addition, awareness of the disease and the reduction of the stigma associated with the disorder can help promote a more welcoming environment for those struggling with depression. Conclusion. Depression is a serious disease that can affect anyone, regardless of age, gender, or social status. Proper treatment is essential, and seeking help is the first step to recovery. Depression is not a weakness or a character failure. It is a treatable medical condition, and those who suffer from it deserve to be heard and supported. If you or someone you know is experiencing symptoms of depression, it is important to seek professional help. Remember, recovery is possible, and asking for help is a sign of courage, not weakness.